Bloating is one of the most common GI complaints in the United States, yet most people treat it as a mystery they just have to live with. Research shows bloating is not random. It has identifiable causes, and most cases can be significantly reduced with targeted, evidence-based interventions that most people have never tried. Research shows this pattern is more consistent across populations than previously understood. Research published in Gastroenterology found that abdominal bloating is reported by 16 to 30% of the general population, making it more prevalent than many conditions that receive far more medical attention. Yet it is frequently dismissed in clinical settings as benign. The research shows it significantly impairs quality of life and responds well to targeted dietary and microbiome interventions. In this video, we are going to see the primary mechanisms that cause bloating, how to identify which category your bloating falls into, and what the gastroenterology research says are the most effective steps for rapid and lasting relief. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The most common misunderstanding about bloating is that it simply means you've eaten too much or have too much gas. Research identifies bloating as a distinct symptom complex with multiple mechanisms, only some of which involve gas production. Others involve visceral hypersensitivity, where normal gut contents feel abnormally distended, gut motility issues, or bacterial imbalance. The fix depends entirely on which mechanism is driving it. FODMAP foods are the most common dietary driver of fermentation-based bloating. FODMAP is an acronym for specific fermentable carbohydrates that are poorly absorbed in the small intestine and rapidly fermented by gut bacteria, producing gas as a byproduct. Research at Monash University found that a low FODMAP diet reduces bloating symptoms in 75% of IBS patients within 2 weeks. The food list is specific and learnable. Behavioral factors account for a significant portion of bloating that people never recognize as related. Eating too fast causes air swallowing. Carbonated beverages add CO2 directly. Eating while stressed activates the sympathetic nervous system, which slows gut motility and shifts blood flow away from the gut. Lying down immediately after eating traps gas. Each of these is a simple, targetable contributor. The low FODMAP dietary approach has the strongest evidence base for bloating reduction in functional gut conditions. Originally developed at Monash University in Australia, it has been validated in multiple randomized controlled trials. The protocol works in 3 phases: elimination of high FODMAP foods, systematic reintroduction to identify personal triggers, and personalized long-term dietary adjustment. Research shows this pattern is more consistent across populations than previously understood. The highest FODMAP foods, those most commonly responsible for fermentation-based bloating, include specific items that many people consider healthy. Onions, garlic, wheat, legumes, and certain fruits like apples and pears are among the highest fermenters. Removing just the top 5 FODMAP sources resolves bloating in many people without requiring the full elimination protocol. Research shows this pattern is more consistent across populations than previously understood. When gastroenterologists rank the evidence for various bloating interventions, a clear hierarchy emerges. The fastest short-term relief comes from behavioral changes. Dietary changes produce rapid and more lasting improvement. Probiotic and microbiome interventions produce the most durable long-term results but take longer to establish. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The gut-brain axis plays a significant and often underestimated role in bloating. Research shows that stress activates the hypothalamic pituitary adrenal axis, which directly slows gut motility and increases visceral hypersensitivity. In plain terms, stress makes your gut feel more bloated even without additional gas production. This is why people with high anxiety often have chronic bloating that doesn't respond to dietary changes alone. The step-by-step bloating reduction protocol works in layers, starting with the fastest behavioral changes, moving through dietary adjustment, and finishing with microbiome optimization for long-term results. Most people can achieve significant relief within 72 hours of starting the first 2 steps. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The contrast between the reactive approach to bloating, treating symptoms as they arise, and the proactive approach, addressing root causes, reveals why most people struggle chronically instead of resolving the problem. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The evidence here is robust, replicated, and directly relevant to your daily health choices. The specific actions you can take starting today to reduce bloating range from immediate to medium term. Start with the behavioral changes. They cost nothing and produce results within hours. Add dietary changes in the following days. Most people are surprised by how quickly the gut responds. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. Bloating patterns vary by timing and circumstance. Identifying your specific pattern tells you which mechanism to target first, and produces faster results than a generic approach. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The evidence here is robust, replicated, and directly relevant to your daily health choices. Bloating is not a mystery. It has specific, identifiable causes: FODMAP fermentation, behavioral gas swallowing, gut motility issues, and stress-driven visceral sensitivity. The research gives clear answers for each. Starting with behavioral changes and moving through dietary adjustment produces measurable relief for most people within days to weeks. Your gut is waiting for you to give it the right inputs. Chronic bloating robs energy, confidence, and comfort from millions of people who don't know a targeted solution exists. The research has been there for over a decade. The low FODMAP protocol alone has transformed quality of life for enormous numbers of people with functional gut disorders. You don't have to live with bloating. You just need the right information. If today's video helped clarify something, share it with someone who needs it. Most people never see research summarize this clearly.